Welcome to our new video. Today we are going to discuss about the maternal pelvis. This is the articulated maternal pelvis. This articulated maternal pelvis consists of the three bone. This large is a hip bone which consists of the three part. This is a ilium. This part, upper part is ilium. This one side pubis and another side pubis, and ischium. That inner part is the ischium, and this is the sacrum bone. There is the fusion of the 5 sacral vertebrae and forms the sacral bone, and this one is the coccyx. There are 3 bones, and the joint in the maternal articulated maternal pelvis there are 4 joints in maternal articulated pelvis. They are between the sacrum and the iliac part of the hip bone. There is formation of the sacroiliac joint. There are 2 sacroiliac joints, this sacrum and iliac part of hip bone. This one sacroiliac joint, and this is another sacroiliac joint which is fibrous type of synovial joint. Sacrum and iliac, sacroiliac joint which is fibrous type of synovial joint. Between 2 pubis, 1 and 1, this is the symphysis pubis which is secondary cartilaginous joint, and between the sacrum and the coccyx, sacrococcygeal joint which is also secondary cartilaginous joint. The joint, there are 4 joints, sacrum and ilium. Between the sacrum and iliac part of the hip bone, sacroiliac joint which is fibrous type of synovial joint. Between the symphysis pubis and between 2 pubis, that is symphysis pubis which is secondary cartilaginous joint, and sacrococcygeal joint is also secondary cartilaginous joint. For the descriptive purpose of this maternal pelvis, we divide this maternal pelvis into 2 parts, false pelvis and true pelvis. This is the pelvic inlet. Above the pelvic inlet, it is a false pelvis, and below the pelvic inlet, this is pelvic inlet or pelvic boundary. Above this is a false pelvis, and below here this is a true pelvis, and there is the boundary of the false pelvis. Anteriorly, abdominal wall. Anteriorly there is abdominal wall. Posteriorly, above this there are lumbar vertebra, and laterally iliac fossa to iliac fossa, and there is the little function of this false pelvis which gives the support of enlarged uterus during the pregnancy. And let us discuss about true pelvis. True pelvis, for the descriptive purpose, we divide the true pelvis into 3 parts. Beyond this pelvic brim, that is true pelvis, or it is divided into 3 parts. Pelvic inlet, this is called pelvic inlet, and this is pelvic cavity, this whole is pelvic cavity, and the pelvic outlet. Pelvic outlet is further divided into 2 types, anatomical outlet and obstructive outlet. Now let us discuss about the pelvic inlet. This is the pelvic inlet. The boundary of the pelvic inlet is so much important. This is boundary of the pelvic inlet is symphysis pubis. This is symphysis pubis, pubic crest, symphysis pubic crest, pubic tubercle. This is pubic tubercle, and this is pectineal line up to here, pectineal line. This is iliopubic eminence. This is iliopubic eminence, and iliopectineal line. This is iliopectineal line, and this is sacroiliac joint. Ala of sacrum. This is ala of sacrum, and this is sacral promontory. Again, I am going to repeat. This is symphysis pubis, pubic crest, pubic tubercle, pectineal line. This is pectineal line. This is iliopectineal line, iliopubic eminence. This is iliopubic eminence. This is iliopectineal line, and this is sacroiliac joint, ala of the sacrum, and sacral promontory. This is sacral promontory. Sacral promontory is the most bulging part of here. This is sacral promontory. Now there are various diameter of pelvic inlet. There are total 5 diameter. Among them there are 3 conjugate. Conjugate are true conjugate, obstructive conjugate, and diagonal conjugates. Let's discuss about each of them. The anteroposterior true conjugate is also called anteroposterior diameter, and there are various names of the true conjugate or anteroposterior diameter or anatomical conjugate or conjugate vera. Its length is 11 centimeter. It is the distance between the sacral promontory to the inner border of the symphysis pubis, from sacral promontory to the inner border of symphysis pubis. This is true conjugate or anatomical conjugate or conjugate vera. Its length is 11 centimeter. And obstetric conjugate, it is the distance between the midpoint of sacral promontory, from the midpoint of the sacral promontory to the midpoint, from the midpoint of sacral promontory to the midpoint of symphysis pubis. From here, symphysis pubis midpoint to the midpoint of the sacral promontory, it is about 10 centimeter. And the diagonal conjugate, its diagonal conjugate is the distance between the lower border of the symphysis pubis, from the lower border of the symphysis pubis, from here, from this lower border of symphysis pubis to the sacral promontory, lower border of symphysis pubis to the sacral promontory, it is 12 centimeter. Now transverse diameter. Transverse diameter is the distance between the two farthest point in the pelvic brim over the iliopectinate line. This is the iliopectinate line, and it is the two farthest point, which is 13 centimeter. It is the distance. This is transverse diameter. And the oblique diameter, there are two oblique diameter, right oblique diameter and left oblique diameter. It extends from the sacroiliac joint to the opposite iliopubic eminence, sacroiliac joint to the opposite iliopubic eminence, which is this is oblique diameter, right oblique diameter and left oblique diameter. And let's discuss about the pelvic cavity. This is pelvic inlet. Inner to the pelvic inlet, this is the pelvic cavity. Pelvic cavity is the segment which is bounded above by the pelvic inlet and below by the plane of least pelvic dimension. Plane of least pelvic dimension can be identified by seeing, because it is the narrowest part of the pelvis. Above is pelvic inlet and below is the plane of least pelvic dimension, which is the narrowest part in the pelvis. Its shape is almost round. The shape of the pelvic cavity is almost round shape, and there are two diameters in the pelvic cavity, anteroposterior diameter and transverse diameters, which measures the 12 centimeters. There is some importance of list of pelvic dimension. It is the narrowest plane in the pelvis. Internal rotation of the fetus occurs at this level. Landmark of pudendal nerve block at this level. This level, it is the level of ischial span that indicates the zero station, where above there is the negative and below there is the positive, and head is when the head is considered as engaged at this state. Let's discuss about the outlet. Outlet is further divided into two types: obstetric outlet and anatomical outlet. Obstetric outlet is the segment of pelvis bound above by the plane of least pelvic dimension and below by the obstetric outlet bound above by the least pelvic dimension, which is the most narrowest part in the pelvis bone, and below by the anatomical outlet. And there are three diameters in the obstetric outlet. There are transverse diameter or bispinous diameter, anteroposterior diameter and the posterior sagittal diameter. Transverse diameter is the distance between the two ischial spine. It is the distance between two ischial spine. This from this to this, its diameter, its length is around 10.5 centimeter. And anteroposterior diameter is the distance between the tip of sacrum, not the coccyx. Remember that it is the distance between tip of sacrum to the symphysis pubis. It is tip of sacrum to the symphysis pubis. It is 11 centimeter. Tip of sacrum, not a coccyx. Okay, tip of sacrum to the symphysis pubis. It is 11 centimeter. And posterior sagittal diameter it is the diameter from the tip of the sacrum to the midpoint of the tip of sacrum to the midpoint of the bispinous diameter. It is an imaginary diameter which is 5 centimeter. Now let us discuss about anatomical outlet. Anatomical outlet is also called bony outlet. It has some boundary. The boundary of anatomical outlet is in front. This is the lower border, in front, lower border of symphysis pubis, in front, lower border of symphysis pubis, laterally ischiopubic rami, ischial tuberosity and sacrotuberous ligament, laterally ischiopubic rami, ischial tuberosity and sacrotuberous ligament, and in posteriorly tip of coccyx. Now let us discuss about the diameter of the obstetric outlet. There are 3 diameter of obstetric outlet. They are anteroposterior diameter, and anteroposterior diameter is the diameter between symphysis pubis. It is the anteroposterior diameter is the diameter between symphysis pubis and tip of the coccyx. Symphysis pubis and tip of coccyx, which is this diameter. This is 13 centimeter. And transverse diameter of outlet. Transverse diameter of outlet is 11 centimeter, which is the distance between the inner border of ischial tuberosity. It is the distance between the inner border of ischial tuberosity. This is the transverse diameter of obstetric outlet, which is 11 centimeter, and posterior sagittal diameter, which is imaginary diameter. It is the distance between sacrococcygeal joint. It is the distance between sacrococcygeal joint and midpoint of transverse diameter of outlet. From here to the midpoint of it is an imaginary diameter, which is 8.5 centimeter. Now let us discuss about the subpubic angle. This is a subpubic angle. The angle forms between the 2 descending rami of the pubis is known as subpubic angle, which is 85 degree in normal female. This is subpubic angle. And there are 4 types of the pelvis, mainly gynaecoid, which is most common, around 50%, android 25%, anthropoid 20%, and plateloid is 5%. They are the types of the pelvis. And there is one most common term known as contracted pelvis, in which it is the condition in which the essential diameter of the pelvis are decreased by 0.5 centimeter is known as contracted pelvis. It's all for today. If you like our video, then please like, share, comment and subscribe our channel. Thank you.